program in applied exercise physiology. And today I'm going to be talking about careers in clinical exercise physiology. And the reason that I'll be talking about this today is I've spent many years before becoming a professor as a clinical exercise physiologist working in a hospital. I worked with cardiac patients, people with diabetes, weight management programs, and people with neuromuscular diseases and other chronic diseases. So I can speak both from experience as well as from my perspective as an educator. So today I'm going to talk a bit about how you might, if you want to consider a career in clinical exercise physiology, some of information about what the field is and how you might prepare for such a career, and also give you some information about some jobs that you might look for in the field. So first, I'd like to talk about the occupation of exercise physiology. So first, recently, the National Bureau of Labor Statistics, which is a U.S. government agency that tracks various occupations in the country, does have an occupational code for exercise physiologists. So that's actually shown in this slide. So this is the more general field of exercise physiology, but it also does include clinical exercise physiology. I think the important thing to know as a student is that where the wages are right now, as for 2011, we're about just under $50,000 a year as the median wage, which means that there's a wide range of annual salaries in this field. And there are quite a few employees in this field currently, but one of the other areas that's really interesting and exciting is that it is growing faster than average compared to many other professions, and that there are quite a few opportunities in the field in general, particularly in areas of self-employment or in healthcare or service types of positions. So the clinical exercise physiologist is a specialist within exercise physiology. So a person who is a clinical exercise physiologist is a healthcare professional and who has special training to work with patients and individuals with chronic diseases or who are at risk of these chronic diseases. And we work specifically with people who maybe benefit from exercise training. So where exercise is therapy for their chronic disease, and we work with a wide array of patients. So it includes people with cardiovascular disease, pulmonary disease, metabolic disorders like diabetes, and many others. Most CEPs, and that's the abbreviation for clinical exercise physiologists, work in medically supervised environments. So this would include hospitals or clinics, and occasionally will also work in physician offices or standalone fitness centers that are affiliated with a hospital or clinic. We generally work under the supervision of a licensed physician in our work, but not all of the work of the clinical exercise physiologist requires a physician to be involved. In this slide, it's showing some of the areas where clinical exercise physiologists might work. So cardiac rehabilitation, pulmonary rehabilitation are the areas that have been the long-standing areas that employment has been available for clinical exercise physiologists. We also do work in diabetes education and can, in fact, be certified diabetes educators working in diabetes clinics or in hospitals who are treating diabetic patients. Increasingly, we're working in weight management programs, helping individuals lose weight, and a growing area is working with people who are undergoing bariatric surgery or lap band surgery to help them lose weight through surgical means. Many clinical exercise physiologists work in clinical or diagnostic exercise testing in departments of cardiology or pulmonary rehabilitation. We often work alongside our colleagues in physical therapy and athletic training and sport injury rehabilitation, particularly in the period after an individual's completed their treatment course by the physical therapist. Increasingly, we're seeing clinical exercise physiologists working in medical fitness programs, and these are health clubs or standalone programs that are affiliated with physicians or with hospitals where there is medical supervision, and they're more specialized capacity to work with people who have various health concerns that need greater level of expertise than our regular fitness instructor or personal trainer. We also find work in programs, although less commonly, working with cancer patients and cancer survivors, since exercise is recommended for these individuals, people with kidney disease, Parkinson's disease, and other neuromuscular disorders. And I wanted to also mention that, one of the very nice areas that clinical exercise physiologists can work in and where they are in demand is in clinical research settings, so academic medical centers or even working along with pharmaceutical companies and others, that this is a way of combining your exercise physiology work and clinical expertise and working on research that includes exercise and other areas of our training. So if you're interested in working with people with chronic disease and being a clinical exercise physiologist, what kind of training do you need? The clinical exercise physiologist typically has a master's degree in exercise physiology or exercise or movement science or kinesiology, although there are some individuals who work in the field with a Bachelor of Science program, especially in some of the specialized undergraduate programs that include special training in electrocardiography or clinical exercise physiology as part of their curriculum. While not absolutely required for work, generally the clinical exercise physiologist also holds some advanced certifications such as our ACSM clinical exercise specialist or the registered clinical exercise physiologist. Both of these certifications are have extensive testing in areas of knowledge and competencies that would be required to work with an array of people with clinical diseases. The registered clinical exercise physiologist certification is available only to exercise physiologists, while the clinical exercise specialist is a credential that is open to other health professions as well. So in general, if you're in an undergraduate student currently, it would be advisable to get a master's degree to work in the field. And if you currently are in working in the field with a bachelor's degree, over time, there may be some requirements for you to get some additional training to continue to work in the field. I wanted to talk a little bit about the clinical exercise physiology requirements for the registered clinical exercise physiologist, since this is the credential that exercise physiologists only can sit for, and I think it gives the best example of the training that would be required to work in this field, and that most employers would be looking for in a potential employee. So first is the master or doctoral degree in exercise physiology, and the curriculum requirements include at least 2 courses in exercise physiology and exercise testing, exercise prescription, and clinical assessment. You would also need to have a current certification in CPR, basic life support for the professional rescuer or healthcare provider. In addition, you would be expected to have practical experience in a supervised setting. So this could be something that you gain as part of your graduate program, or that you might gain as a volunteer or an intern in a clinical site. But you would be expected to have some expertise in a wide array of areas that would be used as a clinical exercise physiologist. So you should know how to assess a patient or client, how to administer clinical exercise tests, as well as exercise testing to develop the exercise prescription, understand how to provide exercise prescription and train people with chronic disease, so considering how their disease state might affect their exercise abilities or exercise responses. You'd also want to have some clinical skills in electrocardiography and patient education and counseling, and knowledge about other areas of disease management for these chronic diseases in which you would be working. So understanding about their various drugs that they might take, what kinds of treatments they may be undergoing, other types of interventions such as working with dietitian, a physical therapist, and other healthcare providers, and how we all might work together in a team to help that individual become healthier. There's an expectation also that you would have documented clinical experience, and in this slide it's just showing the example of the that you would have about 600 hours of clinical experience to sit for the RSEP certification, and that this would be approximately the amount of experience in these different practice areas that you would gain as part of this clinical experience. So you can see that the majority of the experience hours would be expected to be conducted in the cardiovascular, pulmonary, and metabolic areas. And metabolic area includes the people with diabetes and kidney disease, as well as people who are overweight. And then fewer hours that would be expected working in orthopedic, musculoskeletal, neuromuscular diseases, and immunologic and hematologic diseases. The immunologic and hematological diseases would include people with HIV positive. It would also include cancer patients, people with various blood disorders, neuromuscular. Most commonly would be Parkinson's disease, people with muscular sclerosis, and that type of disorder. So I think probably the most common question I hear from potential students and former students is, well, how can I find a job? And unfortunately in our field, sometimes this is a challenge because our jobs are often not listed very clearly on computer websites such as monster.com. So you really have to look very hard to find jobs that are advertised, but I will say that they are there, and you really have to be very persistent in looking. So I think you may find more jobs listed on ACSM job career website, looking at hospital and clinical center job websites under keywords such as exercise, technician, and stress tests. Often our jobs are not listed in a very standard way, so you really have to look in a more broad way to identify those jobs that would be appropriate for a clinical exercise physiologist. I think the other thing that I would say is that you need to be very proactive in your search. The jobs aren't going to necessarily come to you. So one of the ways that you can do that is by joining and becoming active in professional organizations such as ACSM or the Clinical Exercise Physiology Association or American Association of Cardiopulmonary Rehabilitation or AACVPR. These organizations provide many opportunities for networking, both at state, regional, and national meetings where you can meet working professionals and contacts who can help you in your search. And then, once you can identify these individuals, it's very helpful to contact them to see if they might give you an informational interview or phone call and provide you with some advice about how to look for a job, what kinds of skills and experience that they might be looking for as they're looking for employees, and they may also be able to provide you with contacts of colleagues and others who may be looking for a new hire in clinical exercise physiology. When I was working in the field and hiring individuals, I would often not have a position when I met with students and others who are interested in working as a clinical exercise physiologist. But in 3 months or 6 months when I had a position, the first place I looked were my file of resumes that I had gained through professional meetings and these contacts. So I think it really can bear fruit if you take the time to network in the field. Another way, while you will need to get practical experience to get your certification and credentialing in the field, I think as much practical experience as you can get is really helpful because you have a track record, you have supervisors who've seen your work, and I've seen many of my students over the years get jobs just through those internship experiences because people can actually see you in action. And that also provides you with a good reference for other jobs because that carries a lot of weight when people have actually seen you working as a clinical exercise physiologist versus having your academic supervisor, for example, who just says that you're a good student. Another piece of advice I would give you as you're looking for a job as a clinical exercise physiologist is to really consider broadly many positions that are in a work site, a clinical site, even if it's not exactly the job that you want. In my experience, that often you can get a job, and then as you start working, you can often change that job, and the job will change with you. So when I first started working, I started working mainly in research and doing a small amount of clinical work, and over time my job grew to include a lot of clinical work and well beyond the patient populations that I started with. So I started working mainly with cardiac patients, and over time my job expanded to work with pretty much all the patient populations that we saw at our hospital. So really being proactive within the job can really help you have advancement in the field and make that job very satisfying, and also helps to promote all of us as a profession, because once employers and supervisors see what clinical exercise physiologists can do, it really helps everybody. Because in the future, when they're going to hire someone, they'll think of an exercise physiologist rather than a nurse or a dietitian or a physical therapist for that same job. So I think I have given you an overview of the field of clinical exercise physiology and some thoughts about how you might prepare to be a clinical exercise physiologist, and if you already have training, how you might actually get a job to work in this very, very rewarding field. So I will close at this point. I would certainly welcome your questions, and I've provided my email address, and you can feel free, if you have questions, to email me with your questions.